Move on to hot topics, research and recommendations on heat and health. First up, we have Dr. Minwoo Ahn from the University of Arizona and CLIMAS Southwest.
Thank you. I'm going to share my slides. Let me know if it works. Is this good for all? Awesome. Thank you so much for having me. This is such an honor, and I think my presentation will be a great buildup of what Dave and Chelsea have said. But I think I want to shift focus a little bit on the rural and remote kind of areas, which where I'm in Tucson, but also I think is resonating with a lot of folks in New Mexico, Arizona, and Southwest. I want to acknowledge some of the funders of this research and my research team. So uh, CDC-funded CLIMAS program, a CDC-funded BRACE program, and then NOAA-funded CLIMAS program. Also want to acknowledge Udall Center for Studies in Public Policy from University of Arizona. So here's a roadmap of short presentation. So I want to talk a little bit more about why we should focus more on rural and remote remote area, and then I want to synthesize existing research on rural heat resilience in terms of who is affected, what are the different factors shaping these kinds of impacts, and what are the potential leverages when we think about heat policy, especially in rural and remote areas, and some of the future considerations that needs to be accounted in policy and practice. So you might have seen this picture when people describe heat issue. So in the scholarship, especially the urban planning area, there's been a long focus on urban heat island effects. So in this graph, you'll see that rural area should have much less effect because climatologically, urban area is much more dense. There's much more built environment that affects the sort of the heat dome and the late afternoon sort of, high rise of the temperature. And a lot of us, I think, policy areas, we tend to focus on urban areas and there's much less population. So in the US, 90% of people from the USDA definition lives in urban area, much less in rural area. But I want to shift this gear and I want to show some of our research. This has been published in Journal of Climate Change and Health. And if we start looking at the impact, this is more complicated story. So we took the EMS data from federal agency, CDC-funded data from 2021 to 2023. Among millions of data, we take the heat-related illness data, which involves heat exhaustion, heat stroke, heat cramps kind of data, which accounts for 0.21%, but still there's more than 30,000 data points. I want you to focus on some of the comparison. So basically, we did a simple thing. We take the data and we compare urban and rural area nationally. And what we found is that people end their EMS trip with more emergent conditions in rural area and urban area. If you compare these four different regions, so West, Midwest, South, Southeast, and Northeast, we see much more disparity between urban and rural area in terms of how they end their EMS trip. So there's some clear sort of data showing that rural and remote area is actually suffering a lot from heat related illness. But we want to know why that's the case. There might be many theories that we can easily think of. But before that, we haven't had the data. So we start looking at systematic sort of literature. What are the existing literature sort of tells about these different drivers of inequity? So we primarily focus on extreme heat impact in human communities. So that means that we have excluded studies looking at extreme heat impact on, for example, agricultural crop production, for example. And then we focus on also US, Canada, and Australia, which shares a lot of similar rural sort of remote characteristics. So we end up with analyzing 52 articles. As you can see, this is sort of the search bar graph sort of showing that there's a huge spike in rural heat resilience research, and especially if we break down the discipline, there's a lot of research in public health, obviously, but also agriculture science and geography and planning. But we were mostly focusing on sort of public health side and did not focus too much on sort of agriculture science side and production. So in terms of who is impacted, it is very clear from the existing literature that a lot of literatures are talking about occupational health issues and sort of agricultural workers. So some studies showing that agricultural workers are staggering 35 times more likely to die from the HRI. And especially in the US, there's lots of studies from Florida, North Carolina, um, California, uh, issues about migrant and seasonal workers. And they tend to have really sort of different compounding factors that shape those vulnerabilities, including sort of housing conditions, physically demanding work, sometimes very limited social networks, and sort of language issues. And then obviously there's lots of focus on elderly, poorer populations, and not many studies on indigenous populations. So some of the studies we look at are almost exclusively from Australia. So there's much needed attention on indigenous populations in the US. And obviously these sort of areas are famous for visitors and tourists. So this is very much a concern. I think this was mentioned in Chelsea's presentation too, that there are different sort of factors that shaping uh, inequities. And one issue is the definition of heat threshold. So people often think that, oh, when we are in 105, there will be more likely to have HRI. But a lot of these different existing studies show that HRI actually occurs in climatologically more normal. People tend to be probably less prepared, or there might be different reasons, but what we observe is that the HRI occurs from 31, not 40, 45 degrees of Celsius. And we see a huge socioeconomic and spatial variations. There's many studies sort of pointing out that it is related to socioeconomic disparity. And many of these studies also focus on the specific subgroup. So for example, Latino farm worker study has been done extensively. I want to point out a couple of parameters that we need to think about when we think about rural heat sort of governance issues. First, many studies point out a lack of proactive labor safety regulations. This includes sort of trainings, water and shade access, so it's general lack of policies. And also a couple of studies point out urban and rural differences in management. So one of the most famous strategy, cooling strategy is a cooling center, especially in Arizona and many of the urban areas. But those kinds of policies may have barriers if we think about rural and remote area that have different transportation mode and sort of lack of AC, different kind of housing structures. And also, many of these studies talk about what are the leverages that we have. The rural area tend to have different lifestyle and identity. They tend to exhibit higher levels of social capital and strong sense of belonging. And the way they communicate may be a little different than very urban centered areas. So these are really important issues. And we also had a survey I didn't show you in here, but a lot of county and officials, health officials saying that there's just lack of climate vulnerability data, especially heat health data. So there's a much need for that. So when we think about rural heat governance, the way it is defined now is the actors, strategies, processes, and institutions that guide decision-making for mitigating and managing heat as a hazard. So this is the definition that was adopted in NOAA and federal agency too, but this is sort of the framework, and we still feel like do not have a models of heat governance in rural and remote communities. And my hunch is that we really need different models. There are some similarities I think we can still take from the urban areas, but we need a different approach. I want to acknowledge that rural area, although I sort of say that, very roughly urban versus rural, but rural area has much diversity within it. It's not monolithic place. And we have an ongoing research on rural heat governance issues in Arizona, New Mexico. So we are recruiting actually in-depth interview participants. I noticed that there's lots of social work professionals, public health professionals here. So feel free to contact me. We'd love to learn from you. So it'll be great. I want to share a couple of resources before I end the presentation. Um, Obviously, heat.arizona.edu, we launched a heat resilience initiative. We'll be the Center for Heat Resilience in the fall. So there will be lots of different reports, data, and everything. But you can also see um, other resources too. So please look at these resources. Thank you so much for your time. I think time is up. I'll stop sharing.
Thank you so much, Dr. Ahn. If you have any questions, please post them into the chat. I have one right here. How or what are ways that rural communities can leverage their high levels of social capital to improve their resiliency this summer?
That's such a good question. And I don't have a clear sort of solution type thing, but a couple of studies actually showing that um, really sort of doing using existing partnerships, and rural area tends to have existing partnership. Probably, I don't know, there may be some partnership in water access in those areas. So instead of sort of reinventing, instead of, you know, having a new kind of partnership for heat issues, I think using sort of existing institutions and actors really makes sense. Um,
We also had another question. Are these data still available given the federal government's changes in climate
yeah,
and health regulation?
that's such a good question. We were stepping aside. I've been stepping aside that conversation a little bit. Um, so answer is no. A lot of NEMSIS data, especially we use, I think is not available now. And there's still some data at HEAT.gov. So the HEAT.gov has heat health data. And we are in the conversation potentially in some emergency cases. Uh, we are trying to host some of those data sets in our website. So those data are preserved. So there's a lot of serious data issues that we are worried about. But we'll do our best, I guess.
Yes, of course. Thank you so much. Do we have any more questions? You can raise your hand, put it in the chat. Do you have an idea of the level of detail of the data that we have? At what level geographically? To what degree?
Right. So we wanted to do more fine-grained data analysis, obviously. So we are asking data to for state of Arizona, but also we'll want to have more data to have more fine-grained analysis because we couldn't track down the data more fine-grained level to understand the drivers. Although we did a systematic literature review and checking existing literature. But that's sort of our future projects that we want to have, for example, zip code level data uh, to track down. I think heat.gov has data at the 2024 at the national level, um, but it's such nascent field, and I don't think that there's a 5, 10 years of accumulated data. So I think that's a big endeavor I think, for all of us to track down and um, those data and learn more.
We have one more. Healthy Climate New Mexico recently facilitated a heat tabletop exercise with tribal communities, and we were really impressed by the role of community health representatives and community health workers in supporting the geographically dispersed community members. Can you speak to their role, CHR, CHWs, in supporting rural communities and heat safety?
So I think New Mexico is doing a great job. I think Arizona should learn more from them. And I think tabletop exercise is great. We are also trying to do similar to that tabletop exercise, especially not only the heat, but also we have wildfires here in Southwest. So there's sort of dual hazard. But I think in terms of this, I think New Mexico seems like doing more serious work probably than us. So we would love to learn from you.
Oh, and vice versa. Thank you so much, Dr. Ahn. Thank you. We are